Hawaii, greetings. My name is Vandy Crane, founder and director of the Rise and Love Foundation, an Indigenous survivor-led organization that is committed to creating safer spaces for individuals, communities, and families that are heavily affected by trauma. So that's why we're making this series. Over the last couple of years, we worked with the support of the Department of Justice and Office of Victims of Crime to develop a series of survivor-led trainings for Indigenous survivor leaders, as well as Indigenous survivor-led trainings for professionals and providers. We also wanted to create a resource or series of resources that would be available to anyone free of charge. So that's what the series is intended for. Resources for self-advocacy, self-determination, with the goal of Indigenous liberation. I myself am a Wajashi Wamblanecha. I was raised by my Osage grandmother. I experienced child trafficking. I escaped. My background, my education background is in addictions counseling, integrated studies, and my graduate work is in applied behavioral analysis, but my passion is intersectional work in anti-trafficking, preventing missing and murdered Indigenous relatives, and creating resources for systemic approaches for systemic change so that we can address these crises in our communities. So our work has been developed over years, over the last 12 years. Most recently, we got to work with a team of amazing Indigenous strategic planning consultants, Dr. Begay and Dr. Randall. Dr. Begay is head of Native American social work at Washington University in St. Louis, Missouri, and Dr. Randall from Muskogee Creek Nation Tribal College. They were amazing to work with. We had a communications consultant. So our work is developing, and we have a plan to grow our work over the next 4 more years. And we look forward to elevating those that we work with as we evolve our work. So with that, the purpose of today's video, and I don't create this content for likes or followers or comments, but if you would like to subscribe or like or follow, or even better yet, share this resource with somebody that you think that could benefit from it. That's the purpose of this content, is to help others. So with that, let's get into it. So today we're going to talk about historical trauma, intergenerational trauma, cataclysmic trauma, and adverse experiences, and how those impact us as Indigenous peoples, or people with mixed ancestry who are also Indigenous. Essentially, we're all Indigenous to somewhere with varying degrees of separation. So this work has been informed by the work of Dr. Yellow Horse Braveheart, Associate Professor of Psychiatry and Behavioral Studies, as well as the Director of Native American and Disparities Research, excuse me, Dr. Gabor Mate. And we are also working in partnership with Create Inner Peace, an organization that was created to support first responders in addressing trauma related to critical incident stress. So this series is a product of several organizations and groups. We're also a member of the National Association of Boarding School Healing to create resources, more resources for those of us who have experienced the intersection of historical trauma, intergenerational trauma, and ongoing cataclysmic trauma and adverse experiences, and how those impact our nervous system. So we hear those words a lot, but what does it mean exactly? What does it look like in our lives? So the emotional components of historical trauma and unresolved grief often look like depression. I know so many of us are familiar with experiencing depression and those cycles that seemingly reemerge that create patterns of self-sabotage. And those are very painful, and they kind of snowball and affect with the shame we experience. And that shame is often connected with sexualized violence from trauma from childhood that we didn't or haven't been able to address. And then that is compounded by the boarding school trauma that our ancestors or even family members, living family members, have experienced, and how that impacts our relationships. And oftentimes there's unsettled, unresolved, and sometimes even unnameable emotions that we feel. Emotions that feel heavier than any weight you could imagine. Because we're carrying it in our DNA. There's a sadness that exists in our DNA that we're not responsible for, but we're responsible for carrying and what we do with it in our lives and how it manifests in our thinking and our patterns of feeling and our patterns of relating to others and the world around us. These forms of emotional trauma can also come in the form of survivor guilt. If we say get sober and we watch our family members continue to drink themselves to death, we have this guilt for why did we get out? Why are we healing? And sometimes we feel unworthy of our own recovery or of our own healing. Anger. Anger is a huge one. What do we do with all this anger? What do we do with the anger from ongoing injustices and the crises that we're constantly witnessing in our communities? Another form that historical trauma manifests as, and I had to look this up myself, is poor affect tolerance. So what is poor affect tolerance? It's our inability to handle the intensity of those emotions we feel within us. And as a result of not being able to handle that pressure, that emotional pressure in us, we act out in ways outside of us that are harmful to ourselves and others. And even though these behaviors might be harmful, it's a way of controlling situations when we aren't able to control the intensity of that emotion that we feel on the inside, because sometimes those emotions feel like they can kill us. And sometimes, often, they do, through coping with those emotions through substance and alcohol abuse, or even gambling or sex addiction, or shopping and of course, the decision to unalive ourselves. I myself struggled with suicidality and substance use for 13 years after experiencing trafficking. And that's a whole nother conversation we need to have as BIPOC people, is human trafficking is historical trauma for us, and historical trauma is human trafficking for us. There's no separation between the two. So poor affect. Other ways of trauma manifesting is fixation. What is fixation? Thinking one thing is the issue, not having the ability to look at things from a bigger picture or a universal sense, big picture. An example of fixation for myself, when I was younger, when I first gotten out of treatment after my traumatic experience as a teenager, I thought, well, the problem is this one specific drug. If I just stay clean from this one specific drug, my life will be better. And I was fixated on it. That's, for example, thinking that the only problem is colonizers, without seeing how we contribute to our own demise in our communities through corruption or lack of connection or judgment or lateral violence, or all the different ways that our trauma manifests. We may have preoccupation with death, and that preoccupation is very real, especially when we have relatives constantly making their journey. We may have a fixation on the past traumatic experiences, not being able to release those, constantly reliving them, constantly feeling like we're reliving them. Other manifestations include nightmares of historical trauma context, night terrors, and of course, nightmares from cataclysmic trauma or adverse events. So adverse events, those happen every day to all people from all walks of life. And even though they may seem minor in comparison to bigger traumas, they still have an effect on us. Those minor incidences, betrayals, abandonment, divorce, all the different things that we just naturally experience as human beings that cause pain and suffering and sometimes emotional growth. And what our intention is to support others in having more resources for healing and emotional growth, rather than staying stuck in those cycles of trauma. So this series is committed to, this specific series is committed to wellness. We'll be doing mindfulness practices, affordable basic ways we can take care of ourselves and promote healing in our mind, body, and spirit. And knowing all those are connected, and we can't treat one without treating the other. So our traumas also manifest as physical symptoms. We have a higher mortality rate. We die more from chronic illness, suicide, violence, hate crimes, trafficking, missing and murdered, alcoholism. We just have a higher death rate, and we have higher incidence of inflammatory diseases due to constant trauma. And those inflammatory diseases include diabetes, heart attacks, heart disease, high blood pressure, rheumatoid arthritis, lupus, ethos danners. I'm probably mispronouncing that, but all kinds of autoimmune disorders. I myself have mast cell activation syndrome, which is a histamine disorder, which I've had to learn to treat holistically, naturally on my own, because Western medicine really didn't help me manage my symptoms. And that might be an entire another video series to just talk about how we can support the healing process with autoimmune disorders. Other ways that our trauma manifests is in our behavior. And that can look like self-destructive behavior, cycles of self-sabotage, wondering, why am I like this? Why can't I stop these patterns? I know I want to do differently, but I can't. Or I do for a while, and then I sabotage. Substance use, suicidal ideation, suicide, all the things that increase our mortality rates. And another factor of how historical trauma and unresolved grief manifests is through identity. We take on victim identity. And it's very easy to get into the habit of putting all of the blame out here. And I'm not saying there is not external blame. There's absolutely external blame. There's absolutely systemic racism. There is absolutely hate crimes. There's absolutely sexualized hate crimes. But how can we take responsibility in our daily lives and how we think and how we treat ourselves and how we treat each other and how we show up for our community that will impact those same issues in a positive way and have an opposite effect as those outside forces that are destructive. So with that, I think I'll end this video. If you have any questions about historical trauma, about intergenerational trauma, about cataclysmic trauma or adverse experiences, I'm not the expert on everything out there, but I'm happy to help you find more resources. If you have any comments, I'd love if we can create a positive community and resource in the comments to support each other in our own healing so that we can support our families and our communities in the healing that we really need.